Soumitra and you are watching my YouTube channel Medico Soumitra. So today I am gonna share an important topic, that is uterine cancer. Okay, you know very well, right? Uterine cancer. So in women, like breast cancer and cervical cancer, there is one another important cancer is named as uterine cancer. We'll see detail in uterine cancer. Okay, so basically what we'll see in uterine cancer. Introduction. Uterus cancer is also named as uterine cancer. Most uterine cancer occur in the layer of the endometrium, which is inner and muscular layer of the uterus. Being overweight and periods in early age can be the leading risk factor for uterine cancer. Obviously. So uterus cancer is also named as a uterine cancer. Like uterine cancer in the sense what we call as uterine cancer in endometrium layer of the uterus that is only affected by the cancer cells, then we are calling it as a uterine cancer. Okay, now we'll see the definition. A malignant tumor of the uterus which occurs most often in women between the ages of 55 to 70. So, and abnormal bleeding after the menopause is the most common symptom. So a malignant tumor, a malignant cell which is responsible for the cancer. Okay, so a malignant tumor of the uterus, most of the cases occurs in women between the ages of the 55 to 70. And abnormal bleeding after the menopause means the menstruation period, after the stoppage of the menstruation period, the most common symptom can see. Now we'll see causes. Causes are age, estrogen levels after the menopause, being overweight or obese, reproductive history, high level of insulin, PCOS, and endometrial hyperplasia. So, what are the cases or causes for uterine cancer? We'll see age. So, in age, definitely, as we told in definition, the age group of 55 to 70 in women, they are the highly risk for the uterine cancer. And estrogen levels after the menopause, if it is not controlled, then it could be leading to uterine cancer. Being overweight or obese, that is also one of the cause. Reproductive history, obviously there is a previous history of the cancer in reproductive system, then definitely it could be the high risk for the uterine cancer. Then high level of the insulin and PCOS, obviously PCOS in the sense polycystic ovarian syndrome. So in polycystic ovarian syndrome is multiple formation of the cyst in ovaries that could be leading to the stoppage of the menstruation period and irregular bleeding of the menstruation, like from the uterus, right? And endometrial hyperplasia. Next we'll see the pathophysiology. So in pathophysiology, what we'll see, when there are errors in normal endometrial cell growth, when cell grows old or get damaged, they die. New cells takes place. Cancer starts when new cells forms unneeded, and old or damaged cells do not die as they should. So what is telling in pathophysiology? When there are errors in the normal endometrial cell growth, definitely if there is an error like endometrial hyperplasia, which is abnormal growth of the uterus, right? So it is an error in normal endometrial cell growth, that could be one of the important cause for the uterine cancer. And whenever we can see the new cell growth in the uterus like malignant cells, that could be dangerous to the uterus, right? So in that case we can see the uterine cancer started, or cancer starts when the new cells forms unneeded, whenever the new cells forming unnecessarily which is not needed. Okay, so that kind of cells is harmful to the uterus as well as the woman, right? So it could interrupt the menstruation as well as the whole reproductive system, right? And because of the new cell formation, and we can see the old or damaged cell which they should die, they are not dying, they are still present in the uterus, so they can interrupt or they can induce the uterine cancer, right? Next we'll see the stages of the cancer, uterine cancer. So stages of the uterine cancer we'll see stage 1, stage 2, stage 3 and stage 4, right? In stage 1 we'll see the cancerous cells are found only in the uterus. See, in case of the C, in case of the stage 1 we can see the cancerous cells are found only in the uterus. You can see, right, in the image. Next we'll see the stage 2, the cancer has spread to the cervix. So in stage 2 the cancer cells are not only limited to the cervix, not only limited to the uterus, it is also getting spread to the cervix, cervical internal os and external os. Next we will see the stage 3. The cancer has spread outside the uterus to the nearby lymph nodes, ovaries, fallopian tubes or vagina. It has not spread to the bladder, rectum or outside the pelvis. In case of the stage 3, we can see the cancer is not only limited to the cervix as well as it is spreading to the lymph node, ovaries, fallopian tubes or vagina. But in case of the stage 4, we can see the cancer has spread to the bladder, rectum or outside the pelvis. Okay. So, stage 4 of the uterine cancer is most dangerous, which is not only affecting the uterus, cervix as well as it is affecting the surroundings or extraneous area of the reproductive system, right? Now we'll see the stage 1. So in stage 1, as I told, like it is only affecting the endometrium cell. You can see the picture, right? So in endometrium layer only in case of the stage 1 is affecting. Now we'll see the stage 2. So in stage 2, endometrial cancer has spread into the connective tissue of the cervix but has not spread outside the uterus. So it is not spreading outside of the uterus. It is limited to the cervix, not other areas, right? Then it is limited to the cervix, cervical os. Then we'll see the stage 3. So in stage 3 we can see the cancer cell has spread to the lymph nodes, then to the lymph nodes and the ovaries, fallopian tubes, right? You can see in the diagrams. See the lymph nodes, pelvic lymph nodes, then uterus, cervix, fallopian tubes, ovaries, all are getting affected because of the cancer, malignant cells, presence of malignant cells in the uterus. So in case of the stage 3, we can see the spreading of the cancer cells to the surroundings. Then we'll see the stage 4. In stage 4, we can see the spreading of the cancer cells, that is malignant cells, are spreading not only limited to the cervix, uterus, fallopian tube and all, it is also spreading to the surrounding regions. Then we'll see the warning signs of the cervical cancer, that is unusual vaginal discharge, abnormal vaginal bleeding, heavier and longer menstruation cycle, discomfort while urinating, loss of bladder control, pain during intercourse, constant fatigue, pelvic pain and unexplained weight loss and leg pain. So these are the cervical cancer warning signs. If mother is having this kind of signs, so they can go to the checkup for preventing the cancer, right? So unusual vaginal discharge, abnormal vaginal bleeding, heavier and longer menstruation cycle, discomfort, urination, loss of bladder control, no pain during intercourse, constant fatigue, then pelvic pain, then unexplained weight loss and leg pain. So these are the warning signs of the cervical cancer, whereas the woman can go for the checkup, right? Then we'll see the symptoms. So in symptoms of uterine cancer, you can see including bloody or watery discharge that might smell bad, right? So bloody or watery discharge that might smell bad, then discomfort or pain in the abdomen, difficulty or pain when peeing, then pain during sex, bleeding between periods or after menopause. So these are the basic symptoms of the uterine cancer, like abdominal pain, no foul smelling, then pain during sexual intercourse, right? And then bleeding between the periods, like interrupted bleeding, interrupted periods, right? So these are the basic symptoms of the uterine cancer. Now we'll see the diagnostic findings. What could be the diagnostic findings that we can easily find that patient is having uterine cancer, right? So first we'll start with the history collection, including medical, family, past, present history of the cancer. Obviously we need to check the history collection. We need to check the history of the patient, like previous medical, family, past, present history of the cancer is having or not. Then we'll do the physical examination. So physical examination, we can see to detect the enlargement of the lymph node. Then we'll see the endometrial biopsy. Obviously we need to do the endometrial biopsy. Why we need to do the endometrial biopsy? If there is presence of any sort of malignant cells, right? So then we can do the biopsy, endometrial biopsy, to detect the presence of cancer cells. Then transvaginal ultrasounds, then pap smear. Obviously if the uterine cancer is spreaded up to the cervix, definitely we need to do the pap smear test to collect, to detect the presence of cancer spreadingness and dilation and curettage, right? Then we'll see the treatment, right? So treatment, what we'll see in treatment, we can see radiation therapy, chemotherapy, hormone therapy, and including surgery, hysterectomy, salpingo-oophorectomy, and pelvic lymph node dissection. So in treatment we'll do like radiation therapy, chemotherapy, hormone therapy, surgery. And hysterectomy, what we'll do? In hysterectomy we'll do the removal of the uterus, and salpingo-oophorectomy means removal of the fallopian tube and along with the ovaries. And pelvic lymph node dissection, as I told, in stage 3 of the uterine cancer, it is spreading to the lymph node, so this is the surgery. See the total hysterectomy, how it is doing in picture. See total hysterectomy, radical hysterectomy, and total hysterectomy with the salpingo-oophorectomy. So